Hello, everybody. I have Dr. Abhilasha Karkey, who is the Vice Director of Okru, Nepal. Hi, Abhilasha. How are you?
Hello. Hello, I'm good. Thank you.
So I understand Kathmandu has gone into lockdown again.
Yeah, as of today, we're in lockdown again. So after a brief 3-week respite, we're back into lockdown.
I
Yeah.
mean, obviously, the very long lockdown in Kathmandu has had a big impact on Okru, Nepal, and how things are managed this year. What else how else has Okru, Nepal been affected by everything in 2020?
Yeah. So yeah, it's been a weird year. So we had a 4-month lockdown, which was massive. But then we had 3 weeks respite, and then now we're locked down again. But so there are lots of uncertainties. There's a lot of crime going on, I think, because of the economic backlash, etc. But it has also meant that working conditions in the hospital has changed. So Patton Hospital, where we're based, is one of the main COVID hospitals for the government. So that means it's seen a lot of inflow of patients, and because we've been in charge of the fever clinics for the last 17 years, we've sort of been at the front line. So our CMAs and doctors are in the COVID fever clinics. They were the ones who got pulled in first. And we were in the middle of a structural reorganization, so there was all that uncertainty. And you throw in COVID, we have a very nice do at the moment. But I guess we're learning. It's been a huge learning curve, I think, with all the uncertainties, being flexible, working with the hospital, etc. So, I mean, each day is a new adventure. We'll see what happens tomorrow.
Are there some, I mean, there's a lot of changes that you've had to make, but are there some specific, like day-to-day changes in the way you work to support research? And yeah.
Yeah, yeah. So I mean, there have been massive changes. So we've sort of suspended all of our research activities at the beginning. So
Mm-hmm.
apart from doing COVID work, we suspended a lot of the ongoing research. Um, we have been working with the hospital a lot. So most of us are now involved in routine hospital care, etc. With COVID work, which has been actually a very nice thing. I think it's one of the best collaborations we've had with the hospital, I think, in our 17-year history, is working very closely with them, looking after patients, and also thinking about doing COVID research work, which the hospital really wants to do. So because we've all been drawn into the hospital work, it's just meant a huge shift in the work that we do. And even for the administration, it's been a lot of balancing things out, knowing how to, accommodate the urgency of getting equipment and PPE and stuff. So I think we've learned, I think there's a lot of stress, but somehow I don't know, somehow COVID has brought about a teamwork
Yeah.
between not just the unit, but everyone in the hospital and the patients who are like, when we're handing out PPE, there was a patient who was like, oh, you don't need to give me gloves and masks. I have my own. So he was like, someone else might need it. So I don't know. It's just brought about this humanity in people, I guess,
Yeah.
which has been
Yeah.
nice. And I think that's changed my perspective in the day-to-day work that I do, is just how we approach work. Um,
That's really nice. Like thinking about, it's obviously we don't want to be in this situation with this urgent situation, but actually there are opportunities here for us to work together and work differently because of the urgent situation we're in.
Yeah, and it's strange, like I'm in touch with researchers in Vietnam just trying to set up COVID research and then
Mm.
going back to the war to do it. So yeah, somehow it seems, even in research, I feel more support. I don't know if this sounds strange, but I feel more supported than before COVID somehow. I don't know. There just seems to be a different level of connectedness
Yeah.
um, with the wider team in Vietnam and Indonesia, as well as in Patton Hospital ourselves. So yeah, it's like I said, it's a huge learning phase.
Yeah, that's really nice. What are there, out of all of these changes and the different things that you've had to do this year, are there any things that you think you'll end up keeping, and that even after the COVID situation is much more under control, that you will keep working in these different ways?
Yeah, I mean, I think one of the things that we really became aware of was the mental health of staff. Um, you know, working in Kathmandu, I guess working in any metropolitan city is not easy, but with everything that was going on in Kathmandu, in the hospital, in the research unit, a big changes happening before COVID. Um, a lot of staff were under mental stress, but no one really said it was mental stress. It was like everyone's just working too much. But with COVID, we started talking, in small groups, started having conversations like, what our Sumita, who runs the PE program, she calls virtual tea talks. Um, so we started having these weekly conversations, and I've sort of realized how much mental health needs to be taken care of among research staff with or without COVID. And I think that's something we'll keep, these talks that we had. Otherwise, we never had them. And, just even though there's no support that maybe we could give immediately, I think just talking about it helps. And a lot of people did come up and say, just talking about my experience helped.
Yeah.
So I think that's something we'll keep.
Yeah.
And I think all of us have learned to be a little flexible in our relationship with the hospital, in our relationship with each other, in the way we work. And I think that's going to stay on. I think it's the first time that researchers have sort of been more flexible, like, when we're not able to procure items as quickly as they would like us to. I think it's the first time they've understood that.
Yeah. Yeah.
So I think the flexibility in the way that we work is something we'll keep. And and I think the most important thing that we'll keep is we've got a better coordination with the hospital nowadays. And I think that's something definitely we'll even put more effort into continue. So yeah, I mean, the most important thing from all of this in our coordination with the hospital, where, we're working with them in the wards, we're working with them in the OPDs, and we're actually trying to think of research projects that we can do together. And, they're coming to us to ask, how do we write this proposal up? We're going to them saying, where can we get the samples? How do we do this? So I think this is something we'll really work hard in continuing to keep and improving on, because we've never been here before. And I think it's fantastic that, I mean, not happy that it's taken COVID to get us there, but at least something has gotten us there. So
Yeah.
that's something that definitely will be keeping in the future.
Okay, that's really great. Are there any really special contributions that among the research support staff in your organization that you're really proud of?
Yeah, I mean, to be honest, we've got a very small, support staff, like just one or two people who do the whole support of all the research that we do. And the amount of, like I said, the amount of flexibility that they've shown, and how, when they have 5 different people shouting at them for some PPE, that they're able to keep their calm.
Yeah, amazing.
That's something yeah, I think I just didn't, I mean, I knew they were great people and I really like how they do, but the strength that they've shown under the circumstances, when we're trying to push to start research and the hospital is pushing them as well, it's fantastic. So I think, that's what I've told them. I'm like, I'm really happy that even if it's just 2, we're really happy that we've got those 2 people, because they're a massive support to us.
Yeah, that's wonderful. That's wonderful. Research Administrator Day 2020. I think Okru Nepal hasn't really celebrated Research Administrator Day much in the past. What about this year? What are you going to do?
Well, so I think for starters, we're going to join the webinar, the Oxford Network webinar. So yeah, we'll start from there. We haven't, but I'm sure from this year we'll be interested in celebrating it.
That's wonderful. Great. We really look forward to seeing you at the webinar and want to say thank you so much for joining us. Just before we go, Abhilasha, do you have any words of support or advice for those of us who are working to support research across the Oxford Tropical Network?
Yeah, so I think I want to say a big thank you. I think it's this year I've realized the tremendous amount of work that you guys do to help us in research. You know, and you know, I think just be who you are. I think people have always been a help, and I know we don't seem very appreciative at times, but we really are. I think we wouldn't be doing what we are doing now without all the research support staff around this. And I just want to say thank you.
Thank you, Abhilasha, for coming on and talking to us today. And we hope that your lockdown doesn't last too long this time.
Fingers
Take
crossed.
care. Fingers crossed.
Thank you.
Bye-bye.
Bye.